Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. That's BuckeyePMR.com is the website. And today we're going to talk about, well, I kind of start out by talking about how do we break down? How do we end up in our, 30s, 40s, 50s, 60s with degenerative joints and degenerative joint disease, osteoarthritis, bone on bone? How does this even happen? And how come some people have it and some people don't? And I'm going to start off by saying that your joints are designed to last at least 100 years. So saying that you're getting older and you're just getting old and that's why you have back pain or neck pain or shoulder pain or knee pain, that's incorrect. If a joint is taken care of properly and not damaged, it'll last your lifetime. Okay. So what happens? How do you end up with these conditions? And really, you can break this down into two categories of situations. You have controllable things. So what can you control in your life to make sure that your joints last a lifetime? Well, number one is body weight. If you're overweight, and 35% of the population is, that's according to the latest statistics, excess body weight puts excess pressure on your ankles, on your knees, on your hips, and on your back. Now, I put this under the category of controllable because anyone can lose weight. We have a great program at Buckeye, it's advanced medical weight loss. And with this program, it's been proven time and time again, you lose a pound a day for the first 40 days. So anybody, and when I say anybody, I mean anybody can lose weight. So the extra body weight and the way it affects your body, not only your joints, but your overall health is a controllable thing. Poor nutrition. With today's society, people are busy, they're running around, and they don't get a lot of the proper nutrition. People eat a lot of simple carbohydrates, they don't get enough protein, they don't eat enough fruits and vegetables, and these are the things you really need to keep your joints and your body healthy. But in this fast food society and processed food society, these foods that are processed, you're not getting a lot of the key micronutrients. And that's why it's very important to, number one, eat, fruits and vegetables, or if you don't have the ability to eat those or you don't have the time, get a good multivitamin, multi-mineral supplement. These are essential, and for not only for adults, but for children. And I see my kids' school lunches are terrible. There's really no nutritional value whatsoever. So if you're, this is not only important for you, but for your kids. That's also controllable, though. Lack of exercise. The body was designed to move. So everybody has to exercise. Now, that doesn't mean everyone has to go to the gym or run marathons or do CrossFit, but you got to do something at least 5 days a week for 30 minutes, whether that's walking your dog, riding a bicycle, going into a gym. You have to move. If you don't exercise, it's not if, it's when your body will break down. Okay? So the body was designed to move. Drinking and smoking and taking drugs. These are also very hard on the body, and I consider a controllable thing. When you take these toxins into your body, they can lead to cancer and lots of other bad stuff, but they also affect your metabolism, how your hormonal system and endocrine system work, which can have a great effect on your joints and how you age. Stress. Everyone's stressed out, and stress does affect your hormones. I see it every day in the office at Buckeye. We have people that come in their 20s. I had a patient yesterday, he's a PhD student, tons of stress. 29 years old, his testosterone level was out of a 65-year-old. Just terrible, but it's all the stress he's under. He's got to get his PhD. But this stress does kill. Stress does cause you to produce less hormones. When you produce less hormones, these deficiencies can lead to your body wearing out quicker than it should. When we'll go to the next thing, and that's your basically your hormone deficiencies. Testosterone deficiencies, growth hormone deficiencies, even estrogen. These are all essential for joint health and bone health. They just did a recent study, and what these doctors did is they took postmenopausal women who underwent total knee replacement or total hip replacement, and what they found is the women who were on hormones had a 40% reduction in the need for a second corrective surgery if they were on hormones. So right there is all the evidence you need. When a female or male is on hormones, if they're hormone deficient, their bones and their joints will be stronger and they will heal quicker. Another thing a lot of people don't realize is a lot of people come to Buckeye that have been on opioids, and at Buckeye, we treated almost 80,000 patients last year. We didn't prescribe any opioids for pain because we don't believe in it. But unfortunately, there's a lot of people out there with knee pain, back pain, and their doctors have them on these medications, which are highly addictive. Every week in the United States, 650 people die from prescription opioid overdoses. So it's an epidemic. But what people don't realize is testosterone is also necessary for pain control. as this is involved in your body's own opioid production. So we produce opioids ourselves. And if your body has satisfactory testosterone, it's much more efficient at producing opioids for yourself, so you don't need to take these opioids. So you're hearing me right, testosterone does decrease pain. There's no doubt about it. If you're deficient in testosterone and you're a male or a female, your body does not produce its own opioids efficiently, and thus you'll have more pain. Testosterone is also necessary for opioid receptor binding. So what that means is if you're taking opioids or producing your own opioids, if you don't have testosterone and you're a male or female, the testosterone won't bind to the receptor, and thus it won't work. So anybody, male or female, who suffers with chronic pain should get their hormones checked. Get your blood work done. We preach on that every single time. But it's very important because testosterone is not only an anti-inflammatory, it's also necessary for your body to produce its own opioids, and for those opioids it produces or that people take to bind to the receptors. So very, very important. So those are all of the controllable things we talk about. So we'll go one more time. So extra body weight, poor nutrition, lack of exercise, smoking, alcohol, stress, chemical, physical, emotional stress, and hormone deficiencies are why your body doesn't last 100 years, and why you have degenerative joint disease in your back, in your shoulder, in your knees, wherever it may be. Now let's talk about some of the uncontrollable reasons that people end up with damaged backs, damaged knees, and different joints. And basically these are traumas, car accidents, slips and falls, sports injuries. I would tell you the majority of people we have that come in that we do stem cells on their knee that are bone on bone are people that had prior meniscus surgeries. Because a lot of times what they do when they go do these meniscus surgeries is they take the meniscus out. That meniscus is the cushion between the bones. So obviously when you take it out, you lose that cushion between the bones get closer together, and it speeds up this degenerative process. Now, unfortunately, these uncontrollable things are just that. We can't control them, and they can also lead to the breakdown of your body. So the key thing, step one for you, if you're listening to the show, is make sure you keep your body weight in check. Make sure, if you're not eating fruits and vegetables, get a good multivitamin, multi-mineral, go to a nutrition store. Everybody has to exercise at least 5 days a week for 30 minutes. And it doesn't mean going to the gym, but some type of movement. Limit your smoking. I mean, really, you shouldn't smoke at all, and alcohol consumption should be limited. Drinking a bottle of wine every night is not good for you, although some people will say it is. And then make sure to try to keep your stress down and get your blood work done. If you're hormone deficient, if you're suffering with aches and pains, lacks in energy, decreased mental clarity, it's a sign you could be hormone deficient. Get those things checked because these are completely treatable. Now we're going to morph into what chronic pain is and what pain is. So if you have pain, that means you have inflammation, because that's what pain is. So anywhere you have pain, and we're not talking about severe pain, if your neck is stiff, your elbow's stiff, you have inflammation, because that's what happens when you have pain. Now, when pain changes and becomes more serious is when we classify it as chronic pain. The definition of chronic pain is pain that lasts for longer than 3 months. So if you have pain in the same joint or area for longer than 3 months, now you have what is classified as chronic pain. And chronic pain, which is chronic inflammation, is an indication that you have a degenerative condition. So why do I say that? Because if you have pain for longer than 3 months or inflammation for longer than 3 months, we know the joint is degenerating. That's a sure thing. And degenerative conditions all work the same way, just like a cavity. If you have a cavity and don't do anything about it, it always gets worse with time. Or if you have degenerative heart condition and you keep eating Big Macs and smoking cigarettes, it's going to get worse with time. And your joints work the same way. So if you just get up in the morning and have a little bit of back pain right now, a little bit of shoulder pain, or a little bit of elbow pain, and you've had it for longer than 3 months, you need to get it checked out by a specialist, because it won't get better and it only gets worse with time. And just like anything else, when you don't handle problems over time, they always get worse. And degeneration works the same way, whether it's in your knee, your back, or anywhere else. And what it looks like is phase 1 degeneration, which is pain for longer than 3 months, is the cartilage that you have between all the joints in your body. That cartilage is the cushion or shock absorber. It starts to thin out. And when it thins out, you lose cushioning between the bones, and what happens when you lose that cushioning between the bones start to degenerate. And then it goes always, if you don't do anything about a phase 1 degeneration, it always goes to phase 2. Phase 2 degeneration, if you've seen it on x-ray, is usually when the bones are much closer. There's less cartilage there, less cushion between the bones. And if you don't do anything about phase 2, it always goes to phase 3. Phase 3 is the typical bone on bone. You'll get bony growths and spurs. They call those osteophytes. These usually happen on the edges of the bone. You also get cysts that form in the bone or near the joint. Cartilage can break away. And phase 3 is usually the last phase that we treat in our practice, because once you get to phase 4, you're looking at, a fusion in your back or a joint replacement type of thing. So the key thing is, when you have pain for longer than 3 months, jump on it right away and get it fixed. Get it checked out by somebody. So we're going to cut to break, and we're going to come back and talk about degeneration and what you can do to stop it. This is Dr. Buzz with Buckeye Physical Medicine and Rehab. You can also check out our website, which is buckeyepmr.com.
It's 67 likes and how many minutes?
7 minutes.
Oh,
Yeah.
that's better than the radio show.
Cool.
Go.
And I like when you said smoking alcohol.
Smoking alcohol.
You just
Yeah.
put the two together,
Yeah.
and I thought, people are smoking alcohol?
That's a,
Cool.
that's a new thing. That's a new thing.
You're just missing some punctuation.
All right, ready? All right.
Yep. Okay, here we go.
Hey, this is Dr. Buzz. I'm back with Buckeye Physical Medicine and Rehab, and we were just going through degeneration and how it works and what chronic pain is. So if you're listening and you've had pain for longer than 3 months, that means you've had inflammation in that joint. And if you have inflammation in that joint for longer than 3 months, you have a degenerative condition, and it always gets worse with time. So what are your options? Well, you can do nothing about it, right? And what will happen slowly over time if you don't do anything about a degenerative condition is it always gets worse. Range of motion will decrease. You'll start having more and more pain, and it's a progressive thing, and it depends on lots of factors how fast it progresses. I mean, we can go back to those controllable situations. If you're overweight, if you're drinking a lot, if your hormones are messed up, degeneration happens much quicker. If those things are all in line, it can go slower. But the bottom line is, if you don't get that inflammation out of there, it's going to get worse. You can do physical therapy, chiropractic, or massage, and those are great, in particular when an injury first happens. We're talking about within that first 3 months to 6 months. Those are very good modalities. They do become less effective as time goes on. If you have a bone-on-bone condition, those are much less effective, and we'll go over that in a little bit more detail. There's lots of medications out there you can take. The problem is, most of the medications out there, where you're talking about cortisone, steroids, anti-inflammatories, these things really don't fix chronic mechanical problems, and we're going to go into detail in a little bit. You can wait for surgery, right? I mean, that's always an option. You can replace a joint, you can fuse it back. But if you know anyone who's gone through these procedures, they're painful, they're expensive, there's a lot of downtime. And the bottom line is, when you replace a joint, it's never as good as what God gave you. There's no artificial knee or back or anything like that it's anywhere close to what you have from the beginning. And this is where regenerative medicine comes in. Typical anti-inflammatory medications, and I like to hammer this. NSAIDs. What are NSAIDs? So NSAIDs are Tylenol, Advil, Aleve, ibuprofen. These are over-the-counter things. I can send my 11-year-old son to the store and he could pick these up. And a lot of people think, because even a kid can go by and it's in front of the counter, right? So it must be safe. These things are safe, and that's not the case. And I urge people. I'm not here to slam medicine, because we prescribe medications too. But these over-the-counter medications, or these ones in front of the counter, are for short-term use only. And if you go to the cabinet and pull out your 1,000-count ibuprofen and read the back of it, the first two things that it's going to say is, number one, do not take more than directed. And number two, do not take for longer than 10 days. Why is that? Well, because even these over-the-counters, these ones that are in front of the counter, not prescribed, NSAIDs, Tylenol, Advil, ibuprofen, when taken long-term, lead to gastrointestinal and kidney problems. Last year alone, the FDA stated there was 20,000 deaths in the United States as a result of severe bleeding caused by taking these over-the-counter medications. So if you get one thing out of the radio show today, if you're taking these medications on a daily basis, it's not if, it's when you're going to have gastrointestinal or kidney problems. So you cannot take these, even though they're over-the-counter, on a daily basis for longer than 10 days. It's a bad, bad idea. You can try muscle relaxers. There's lots of muscle relaxers out there, Soma, Flexeril. And these are, once again, fine for short-term acute use. When you roll your ankle, you strain a muscle in your back, there's no problem trying these things out in the beginning. But if you're using muscle relaxers for chronic pain, they don't work. On top of the side effects, that you can become addicted to these things: drowsiness, dizziness. They change your vision and can lead to headaches over time. And they also cause you to lose your balance if you're taking these muscle relaxers for a long time, which is a terrible thing for older people because they lose their balance and fall. Next thing you know, they break their hip or they tear their rotator cuff. So once again, muscle relaxers are fine for short-term use, but if you're using muscle relaxers or NSAIDs for chronic pain, that means pain for longer than 3 months, it doesn't work. Opioids. We talked a little bit about that earlier. These have been way, way, way overprescribed for too long. We're talking about Percocet, Oxycontin, the big boys. These things cause tons of side effects: seizures, constipation, unusual fatigue, bleeding, bruising, decreased sex drive. But the big one is they're also very addictive. And we talked about earlier, 33,000 people last year alone died in the U.S. from taking these prescription medications. And that's over 650 people a week. And that's not taking into account the people that get hooked on heroin that started out on these pain medications. And we not only have an epidemic with adults, but we also have it with our children. And the children, they're getting these out of your cabinets and their grandparents' cabinets. So if you're taking opioids for chronic orthopedic, we're talking about orthopedics here, knee pain, back pain, joint pain, it's never going to heal it, and it's only going to speed up the process. And on top of it, you may get addicted, and you got to watch the people around you. So as I said, last year we treated almost 80,000 people at Buckeye. We prescribe 0 opioids because it doesn't make sense for orthopedics. It just doesn't. Cortisone injections. I like to call this old-fashioned medicine. This is something that's been around for a very long time. Corticosteroids and cortisone. Lots of side effects with these too. They can lead to cataracts. They impede your body's ability to fight infection. But the big one, and the reason that we don't use these cortisone injections at Buckeye, and we specialize in spine, joint, and sports type injuries, so these are the injuries we're seeing, we don't do cortisone, is because this cortisone and these corticosteroids cause bone loss every time you inject them. And each injection can cause up to 8% bone loss in as little as 4 months. So that's why, if you think about it, you're only allowed to get 3 per year. Because if you got more than 3 cortisone injections in the same joint within the same year, that would actually be considered malpractice. So your doctor is not going to do it. But if you do the math on that, 8 times 3 is what, 24%. If you're getting these cortisone injections, you're fast tracking getting that joint replaced. So why do doctors prescribe it? You're probably listening, why would my doc be doing that? Well, it is a strong anti-inflammatory, but at what cost, I have to ask you. And a cortisone injection never fixes the problem. You could always just replace the joint, right? But obviously there's risks involved with any type of surgery. 4% of people get infections. 1 in 400 people dies within 30 days of getting their knee replaced. 1 in 400 dies. I don't like those odds. Plus, there's also the increased use of narcotics, NSAIDs, and muscle relaxers when you have these major joint surgeries, because they hurt. I mean, if you know someone who's had a knee replacement or shoulder surgery, it's no joke. Average shoulder surgery, rehab time is about 6 to 12 months. Average cost is between $5,000 and $20,000 plus your downtime. At least that's about 6 to 12 months. Knee surgeries. Knee surgery, knee replacement in particular, is painful. Anytime you're cutting on bone, it's going to hurt. Average rehab time on these is 3 to 6 months. High percentage of these fail within the first 10 to 20 years. Half the people that get a knee replacement actually need to have another procedure done. And your average cost nationwide is around $60,000 for these. And that's not factoring in what's your downtime worth. Back surgery is the big one. Back surgeries you want to avoid at all costs. I mean, sometimes you need it, obviously, but if you can avoid back surgery, you really want to. And the Ohio Bureau of Workers' Compensation just did a survey or a study just here in Ohio, and they took 1,450 workers, and all these workers in the database had the same diagnosis. They either had disc degeneration, disc herniation, or radiculopathy, and half the people had surgery, and the other half didn't. And the crazy thing is, those that had surgery had better outcomes than those that had those that didn't have the surgery had better outcomes than those that did. What they found is the people that had spinal fusions after 2 years, just 26% of those returned to work, compared to 67% of the people who didn't have surgery. And of those 26% who didn't return to work, they were 41% more likely to be hooked on painkillers, specifically opioids. So you always want to avoid back surgery at all costs. And this is where regenerative medicine comes in. So today's talk's not all doom and gloom. So we're going to cut to break. and we're going to come back with some alternatives so you don't have to have surgery or take these medications. And we're talking about chronic pain today, pain for longer than 3 months, that if you don't do something about it is going to end up in surgery. What the heck can you do about it? So we're going to cut the break, and we'll be right back.
You got about 6 more minutes.
Got it.
6.5. I'll give you a 5, 4. Okay, ready?
Yes. Hey, this is Dr. Buzz with Buckeye Physical Medicine and Rehab. That's BuckeyePMR.com is the website. And we were talking about if you have chronic pain for longer than 3 months in any of your joints, you do have a degenerative condition. And if you don't do something about it, it's just going to get worse with time. And saying you're getting older or that's part of getting old, that doesn't buy it. Your joints are designed to last at least 100 years, so everyone can have healthy joints, and you don't have to be in pain. So we talked about all the stuff that you shouldn't do. Let's talk about what you should do, and that's where regenerative medicine, and that's what we specialize at Buckeye PMR. We specialize in regenerative medicine. So what is regenerative medicine? Regenerative medicine is a new science-based approach to healing that focuses on getting the body to heal itself. So if you can get the body to heal itself, it's always better than replacing what's there. What's that encompass? Hormone replacement. I preach on this every show. If you don't have adequate estrogen or growth hormone or testosterone, I don't care what type of rehab you're doing, whether it's physical therapy, chiropractic, massage, whatever you're doing, it's not going to work if those levels are deficient. You're not going to fight inflammation. Your bones and your joints won't heal. We also do shockwave therapy. What shockwave therapy is we use sound waves. And this is not ultrasound. This is much stronger. But they use high pressure sound waves, the same technology they use to treat kidney stones. They also use it. A lot of people have heard of it. We have a lot of horse trainers that come in. They've been using this on horses for years because it really works. But you use these high pressure sound waves on joints and on scar tissue, and it breaks up the adhesions and causes new blood vessel formation, thus getting the body to heal itself. We also do ozone and prolozone therapy, and what this is injecting ozone, which is O3, oxygen 3, into a joint or into damaged tissue. And what this does is the oxygen, which is O3, converts to O2 and actually feeds those cells that are dying and that are inflamed and shuts the pain off. This ozone therapy is amazing for people that have chronic pain. I've literally seen miracles of people that have done everything, had pain for tens of years, get a 1 or 2 ozone injections, the pain's completely gone. So it's a miracle, and we're doing this at Buckeye right here in Columbus. There's PRP that we do also, which is platelet-rich plasma. With that procedure, the patient comes in, we get their own blood, we spin it down, and we harvest the growth factors out of your very own blood, and we re-inject that back into an area where you've had surgery or where you have some type of trauma and where you want things to heal, because those growth factors, just like ozone, feed those cells that are dying and basically brings them back to life and attract other cells to the area. We also specialize, and Dr. Bain, our medical director, is fellowship trained in stem cells. And basically stem cells, there's multiple ways you can get these stem cells, but stem cells are cells in your body that have the ability to, when you put them into an area, they feed the dying cells, they replicate themselves. They live for 28 hours. They replicate for over 60 generations. So really for 76 days when you put these things in, they're growing and reproducing and feeding the cells there. We have the ability to get those stem cells. We can use your own bone marrow. We can harvest your own fat. And we also use cord tissue. And that's people that donate their umbilical cord, and they're actually able to harvest these mesenchymal stem cells off of that also. So those are 3 different ways that we're able to harvest these stem cells and do stem cell procedures right here in Columbus. And this is something even 5 years ago you wouldn't see here in Columbus. You'd have to go to California or go to Europe. This technology is now available at Buckeye right here in Columbus, and it's very affordable for anyone. And all these regenerative procedures, depending on what you need, can start as little as $175 and go up to $5,000 depending on how bad you are or what you need. But we have financing in the office, so anything's affordable. So I highly recommend, if you're listening to the show here and you're on pain medications, opioids, muscle relaxers, or taking, you know, even over-the-counter Tylenol, Advil, Aleve, and you've been taking it for a long period of time for this chronic pain you've had for longer than 3 months, realize it's never going to get better if you don't do something about it. You're waiting for surgery if you don't do something about it. I always recommend call Buckeye. You can go to our website, which is buckeyepmr.com, or you can just call the office directly at 614-600-2378 and make an appointment. We don't charge you anything to come in and get checked out. We only ask you to bring your driver's license so we know who you are, and see if you qualify for one of these procedures. If you do, great, and if not, we'll send you in the right direction, but you have nothing to lose. Just mention the radio show. So I hope everyone got something out of today's show. You don't have to suffer with pain. It's not because you're getting older. Joints are designed to last at least 100 years. So if you have something that's been hurting for more than 3 months, call Buckeye, go to the website, get in here and get checked out. And until next time, this is Dr. Buzz with Buckeye Physical Medicine and Rehab, BuckeyePMR.com.
Get your blood work done.